Hi, I'm Dana Oliver, one of the nurse practitioners at Westwood-Mansfield Pediatrics. The following video is meant to give you some information about cuts and lacerations and an alternative to stitches. It is intended for the patients in our practice, so if you go to another practice, we'll ask that you please speak with your provider to get information. Cuts and lacerations can be scary. When coupled with a trip to the emergency room, long wait times, local anesthesia for pain, and stitches, it could be traumatic for the whole family. Fortunately, we have an option in our office called Dermabond, which is a glue meant especially for the skin to close your child's wounds. We put on Dermabond just like a glue stick, and after it's dried for a few minutes, it's just as strong and effective as 10 days of stitches. Dermabond has some added benefits as well. First, it acts as a microbial shield, which means that it's harder for bacteria to get into your child's cut, and it may decrease the risk of infection. Second, your child can take a shower as soon as it's dried. So while we don't recommend soaking it, it is okay to get it wet at times. And third, as your child's wound heals, which usually takes about 7 to 10 days, the glue is just going to wear away, which means that you don't have to come back into the office for a follow-up visit the way you'd have to have stitches removed. So this will save you a copay and the associated visit into the office. So, what kind of cuts are appropriate for Dermabond? First of all, a cut on the scalp can become sort of a sticky mess when we try and close it amongst your child's hair. Some cuts in that area we can close, so if you're not sure, come on in and we'll take a look. Second, a cut near the eyelid can be a little bit of a sticky situation, as we obviously don't want to get glue into your child's eye. So if you have a cut that's right on the eyelid or very close to the eye, that might be an emergency room trip. Third, Dermabond isn't great for closing cuts that are very jagged or very deep. So take your fingers and try and hold your child's cut together. If the edges come right together, then that's a great option for gluing. If they're very jagged or you can't close it well, you may need to actually go in for stitches. And finally, of course, if you can see bone or fat tissue or muscle, that's probably a cut that's a little bit too deep for us to glue. So for those cuts, you're probably going to need to go to the emergency room for stitches. Of course, anything that's bleeding profusely, that you just can't stop or that you're worried about or think might be a danger needs to go to the emergency room. But for all other cuts, so those that are fairly straight, not too deep, not near the eyelid, and don't seem to be an imminent danger to your child, give our triage nurses a call, and we may be able to bring them into the office to save you some time. So for an appropriate cut, Dermabond is very easy to use. What we'll do is bring your child into the office, we'll wash their cut with soap and water. Depending on your child's age, we may ask you to help us keep them still. And then while we're holding the cut together, we'll take the Dermabond just like a glue stick. We let the tip saturate. And then we paint it on in just a few brush strokes. After a few minutes, this is going to hold just the same way as a week or more worth of stitches, so that your child can get out of the office and get back to having fun. Well, we hope that nobody gets cuts and lacerations this year. If you do, we hope that we'll be able to save you some time, some money, and maybe even some tears by bringing you into the office to do this procedure here for you. If you have any questions, please don't hesitate to call our triage nurses or to check in on the patient portal and send us a message.